Hello everybody, today we are talking about telepharmacy. Let's start with the definition. According to the National Association of Board of Pharmacy, telepharmacy is defined as the provision of pharmaceutical care through the use of telecommunication and information technologies to patients at a distance.
Telepharmacy is considered to be a way of delivering pharmaceutical products and care by the means of telecommunication to different patients. This way, patients can receive their medicines and other pharmaceutical care items in the comfort of where they can get the services easily.
Some of the services provided are patient counseling, weight management, drug information services, medication therapy management, and chronic disease management.
In this video, we're going to talk about telepharmacy service on weight management. Telepharmacy developed a weight management program to help patients with obesity by improving patient motivation and weight management goals. Telepharmacy not only focus on weight loss counseling but also provide ideal planned diet for specific patient condition with range of medical nutrition therapies, diet, lifestyle counseling, and preventive programs.
Our goal in weight management program is to achieve weight loss, maintain ideal body weight for a long term, and prevent further weight gain. In a patient with obesity which is BMI more than 30 kg per meter square, we aim for 10% reduction from baseline weight. It is a realistic and achievable target that can be maintained over time. Further weight loss can be considered if this initial goal is achieved and maintained for 6 months. We will avoid rapid weight reduction as it may lead to an increased risk of gallstone, electrolyte abnormalities, and weight regain. Patients are also guided to maintain ideal body weight for a long term. The rate of weight loss often declines after the initial 6 months of weight reduction. Afterwards, weight maintenance shall begin. Weight maintenance is said to be successful if weight regain is less than 3 kg in 2 years.
Prevention of further weight gain is also one of the aims of the weight management program. If significant weight reduction is not achievable, prevention of further weight gain becomes an important goal considered as a partial therapeutic success for many patients. To join the telepharmacy weight management program, patients are required to register with our telepharmacy service through call or online. After registration, explanations regarding the virtual weight management and counseling process will be provided to the patients. This includes asking for patients' consent prior to the virtual counseling session. The date and time of appointment will be set according to available slot. The patient needs to fill in the patient's information into the weight management counseling form, including their name, identification card number, email address, and telephone number of the patient, along with a copy of the prescription if patients are diagnosed with any related medical condition. Before the counseling session starts, the patient will be contacted at least 1 day before the medication counseling appointment date as a reminder. They may be advised to install any online web conferencing platform such as Google Meet or Zoom into their preferred gadget at least a day before the set appointment date. On the day of the counseling session, patients will have to verify information such as their name and identification card number. Each counseling session is expected to take between 45 minutes. Patients' level of understanding will be re-evaluated 15 minutes towards the end of the session. Afterwards, a date and time for follow-up appointments will be set. A referral to the hospital or health clinic will be provided if the patient's weight is found to be related to any adverse effect from medications or complications from any underlying illness. Clients who do not attend virtual weight management counseling appointments will be traced by the service provider to increase compliance. Patients who are not able to make it to the next appointment will be contacted for more details and further actions will be done, including supportive sessions or setting a new appointment date.
In telepharmacy weight management program, lifestyle modification to achieve weight loss is one of the most important course. Services that are provided include dietary therapy, physical activities, and behavioral therapy.
Dietary therapy is done through reduction of calories and increment of energy expenditure. 3 plans under this therapy include low-calorie diet, low-fat diet, and very low-calorie diet. Low-calorie diet provides a reduction of 500 to 1000 kilocalories per day from maintenance requirement. People undergoing a low-fat diet, on the other hand, obtain 25 to 30% of their daily calorie from fat. However, lower fat diets with total calorie reduction produce greater weight loss compared with lower fat diet alone. Very low calorie diet, or also known as VLCD, results in the most rapid weight loss among the other two, being given in a form of liquid and is limited only up to 800 kilocalorie per day. Patients are often placed under medical supervision as it may result in nutritional deficits. VLCD is indicated for moderately to severely obese patients who have failed with more conservative methods. Physical activities help in weight loss by altering the energy balance, consequently giving better body composition, reducing risk of disease, and improving quality of life. In choosing an appropriate exercise program, the FITT criteria should be considered: intensity, time or duration, or type of exercise. Patient is encouraged to stay hydrated before, during, and after exercise, and practice an active physical routine daily, such as taking the stairs instead of the lift and reducing sedentary time. The goal of behavior therapy is to change the eating habits of an obese patient. Weight loss is more likely to be achieved and maintained by behavior modification techniques, focusing on lifestyle and attitude. Therefore, counseling for lifestyle changes help patients to evaluate and modify eating patterns, as well as incorporate more physical activities. Keeping daily records of physical activity, food intake, and diet-related problems encountered is also important for patients to self-monitor their progress. Besides, coping with stress is also important, as it has been well known that stress may lead to unhealthy eating patterns. This can be done through meditation, relaxing techniques, and establish regular physical activities.
Why is telepharmacy weight management becoming more popular among modern people? This is because it delivers substantial and tangible benefits that, most importantly, improve patient care. Here are the 4 telepharmacy benefits in weight management services. The first one is telepharmacy enables social support to be provided. In weight management services, social support helps increase motivation, encouragement, and commonality to obese patients. Group interventions in facilitating weight loss may be provided, as it is more superior to individual interventions, and patients can receive more support from group members. Individualized weight loss programs that follow the individual needs and conditions regarding their nutrition status, health status, and physical activity can also be provided through telepharmacy. For example, cancer patients can be guided through to maintain a healthy weight and avoid malnutrition. Besides, telepharmacy also gives flexibility to self-monitoring. By using technology, monitoring process can be done by keeping a record on individuals' progress, food intake, or physical activity using handheld devices or online tracking apps. By monitoring patient medication profile, we are able to detect the prescribed agents that may have the potential for weight gain. Telepharmacy can provide counseling service by providing information about proper weight loss programs or better drug alternatives if applicable.
There are few limitations in using telepharmacy service to handle online weight management. First, technology. Some people are reluctant or unable to use the technology, especially the elderly. Not to forget that there are some people who are unable to access such technology that make it difficult to use telepharmacy service. Although we can use text-to-speech program or tools to make it more accessible to the special group, a certain level of IT literacy and skill will still be needed from both parties. Second is cost. The integration of telepharmacy system to the traditional healthcare system has not been implemented, and therefore, patient has to pay for these services. Lower household income may find it financially burdening, especially to acquire software and devices needed. Next is location. Rural resident and community without stable access to the internet connection or insufficient bandwidth will have limited access to the telepharmacy. There are few challenges to implement weight management program in telepharmacy, including the loss of motivation, communication barrier, and trust issue. Halfway into the program, patients tend to become demotivated, especially when they experience a stagnant weight phase or they fail to fulfill their expectation. To avoid this, consistent consultation and education play a major role to keep patients motivated and enthusiastic. The failure to communicate effectively and misunderstanding also lead to poor quality care. To overcome this challenge, a multilingual and well-trained staff should be recruited. As well, we should encourage two-way communication between the pharmacist and patient during the session. Regarding the trust issue, the premise or company must comply with the relevant law and policies such as the Health Insurance Portability and Accountability Act (HIPAA). This will build trust and reputation among the customer on our service.
Nowadays, telepharmacy services are constantly innovating and evolving to find new ways to engage with patients, for example, by introducing First Family Planning Telepharmacy and Selena Plus. The First Family Planning Telepharmacy helps to empower and educate women on their reproductive health and family planning options through accessible oral contraceptives and free teleconsultation by pharmacists. While Selena Plus, a technology that uses a deep learning system capable of thinking and making decisions like human intelligence, automatically assesses retinal photographs of patients with and without diabetic eye conditions, and it is also capable of detecting up to 3 retinal diseases such as diabetic retinopathy, glaucoma suspect, and age-related macular degeneration. The deployment of Selena Plus practices across the country will help to improve the range and quality of telepharmacy services.
Telepharmacy service is a safe and effective alternative to in-person pharmacotherapeutic care delivered by pharmacists. In telepharmacy, pharmacists can play an active role in the delivery of pharmacy services. It gives the opportunity to improve patient interaction with pharmacists since it gives more flexibility and a sense of comfort to patients who have constrained access and inability for an in-person session. From the pharmacist's perspective, telepharmacy allows more thorough discussion with patients since they will likely be prepared for the session, thus making information gathering more meaningful. The utilization of telepharmacy can be expanded into various health interests. This allows a welcoming collaboration with other healthcare teams to deliver the care in the most efficient way. Such collaboration will help to develop a harmonious relationship and increase communication within the healthcare team. With the increasing of elder population, there will be more citizens that require healthcare and making the current healthcare facilities more occupied and more workload on the personnel. Having off-site pharmacists to offer their service is a treasure option. Expansion of this service into local facilities, especially in rural areas, will give the needed aid to the healthcare team and better patient care. All in all, telepharmacy is a promising service with a possibility of further development to improve and make streamlined integration into the patient care service.